guys that want to do something unique. This company can change literally the way we do clinical decisions in oncology.
OncoStats is first of all a clinical tool. It's something that allows any doctor to register better, structured information about their patients. And being able to present that information so clearly, while being empowered by evidence-based guidelines, ultimately results in one thing: better treatment decisions for the patients.
I think that is probably the most unique thing about the OncoStat. It starts from the need of physicians who really understand why this is a critical development for the way we see patients.
So the first thing we did was try to understand a bit more about what we were dealing with. And we interviewed dozens of medical doctors and administrators to understand what the problems were on their daily basis. And we got a bit shocked that there was so much to do in the 21st century.
It should be obvious why treatment decisions in oncology are not made by one single doctor. But even though there's this concept of a team meeting, those doctors are often not fully aware of every patient detail that would have an impact in their treatment decision.
Este programa facilita de tal forma que temos esse acesso rápido, conseguimos visualizar todo o tipo de tratamento que o doente efetuou até à data de uma forma simples e rápida. Permite, dessa forma, que seja sugerido o tratamento mais adequado naquela situação clínica.
We've grown accustomed to questioning basically everything. So even when the doctor would say, but we do this every day, or we got used to doing this like this, we don't really settle for that. So we went on and we went out of our way to get better ideas for the way they dealt with their patients, and they interviewed their patients, and they went on and made those decisions that could probably save their patients' lives.
Eu penso que o OncoStat iria beneficiar por cada doente entre 50% a 75% do tempo de visualização para a decisão da melhor opção terapêutica para o doente.
It enhances oncology care by providing a systematic platform for us to collect, record data, but also to then do analysis of aggregated data that will actually shift probably decision algorithms to something that is much more precise to each patient, which means that it will be much more personalized and will improve the way we provide healthcare to these particular patients.
It's a platform that is meant to live inside any hospital IT ecosystem, a plug-and-play solution that doctors can start using immediately.
The analytics that we can provide is something that not only interests hospital administrators and clinical directors, but also regulatory agencies and pharmaceuticals seeking performance data and safety profiles of their medications.
What is surprising is that it can do this reusing a lot of data that is available and that is now fully passive, that is not being used. It's silent data. They want that data to talk, to actually talk and help doctors.
Multimodal team that is able to collect expertise from different fields and actually create a team that will be able to develop the company to its ultimate goals.
With a solid team and partners outside of Portugal, we can start building a connect data hub that can change the way we treat oncology patients.
We don't need information on 10,000 patients to start delivering value. Give us one patient and we can already personalize decisions about your treatment. Give us 100 patients with a rare disease and we can start changing the way every other patient with that disease gets treated.